Weber booster surgery for tibial hemimelia of type 5A. In all these different forms of type A booster surgery is possible by use of the cartilaginous Anlage. What is a booster surgery? It is the enhancement of the sleeping growth potential of the cartilaginous Anlage. I like to demonstrate the type 5A, where there is a partial aplasia on the both ends of the tibia. So towards the thigh bone there is a partial aplasia, and towards the foot is a partial aplasia. And the end of the tibia is covered by cartilage. And this cartilage is very important. It can be used to create a knee joint and to create an ankle joint. And I will show how to do that. So this is the situation. We have here a gap between the femoral condyle and the tibial plateau, and between the talus and the distal part of the ankle joint. The trick is to do a lengthening of the existing tibia, and lengthening can be done only in the bone. So we have to cut the bone, then we wait 7 days until the bone wants to heal, and the callus, who is soft, we can destruct, and by this we can lengthen the bone until the cartilaginous Anlage proximally here at the area of the femoral condyle is in contact with the femoral condyle, and distally at the foot area the cartilaginous Anlage is in contact with the talus, the foot part of the ankle joint. And after a certain time, this destructed callus will maturate completely in own full sufficient bone. And this is the situation here. So we come from this very small tibia to this, and this one has a joint all of a sudden, because only we brought it into contact with the cartilaginous Anlage. Here this is the knee area, the ankle area. This is the mini fixator applied in the first treatment. Here the bone is cut with very small chisels and the lengthening performed. And how to know when we have achieved the right lengthening? We can do arthrography of the joint, and we know that we have to stop. Okay, and this is after the first lengthening. And what you can see also, at the moment we have done the destruction of the tibial rest, we get already, due to the growth stimulation by the callus distraction, growth plate. So with other words, this leg will grow in a certain amount by itself. Of course, it's not the same amount as on a healthy leg. That's why we have to do a second lengthening, which you can see here. You see here the distance between these two rings. You see how much lengthening I have performed. So, and this shows you on X-ray series the effect of two lengthenings. We started from this small bone and end up with this bone. This is a 400% of lengthening, and this is spectacular. You can do it only in bone transport. In normal lengthening this is not possible, and especially in children who are already prepared for a lengthening. So booster surgery creates joints, the cartilaginous Anlage to a tibial plateau and the tibial ankle part. The maturation of the cartilaginous Anlage with development of an epiphyseal growth plate is the effect of growth stimulation due to the callus destruction itself, and growth stimulation due to the fact that the patients are walking on it. And form follows function. Once the cartilaginous Anlage is in contact with the joint, it becomes a joint partner, a self-growing bone segment. If you are more interested in that, I wrote several chapters in these two books. Thank you for your attention.